Hi, my name is Ronald Wharton. I am a full-time cardiologist at Northwell University Hospital in Manhasset, where I direct the Hypertrophic Cardiomyopathy program. Let's talk about treatment for this condition, which was first described a little over 60 years ago. Mostly since then, we've used medications from 3 different classes, none of which worked ideally, all of which had side effects. And even when we used medications from all the different classes, we would still have a lot of patients with a lot of symptoms. And at that point, we would have to offer them open heart surgery, literally to take out part of the heart muscle to alleviate this obstruction. But for the past 2 years, we have a new class of medications called cardiac myosin inhibitors, which have revolutionized the way we treat this condition. Now, what are cardiac myosin inhibitors exactly? Well, myosin is one of 2 proteins that allow muscles to contract, the other being actin. And when we give these new medications, less myosin, if you will, jumps on the actin rope, and in doing so, we decrease the force with which the heart contracts. And that's the key. When we decrease the force with which the heart contracts, one valve is no longer pushed in the way of the other. And in doing so, we can have the heart beat more efficiently. Because even though it's squeezing with slightly less force, it's no longer squeezing against a closed door, if you will. And because the structure of these proteins in the heart is different than it is in other muscles, you can target the heart specifically without worrying that you're going to affect other muscles like the shoulders, or in the legs, or in your diaphragm. You don't have to worry. This is a very, very safe method of treatment. And what can you expect? Well, once we start treating you with this new class of agents, roughly about a week later, you'll start to notice that things get easier. You'll be able to do things with less breathlessness. You'll be able to do things with less lightheadedness. It's a very, very elegant solution to an old problem. So let me show you what this might look like on an echocardiogram, because now you're experts in echo. This is, again, on the left, a 2-dimensional image of a patient with hypertrophic cardiomyopathy, and on the right, it's the exact same image, but I've added the color. The color splay shows you where the turbulence is, and that turbulence is, again, from that blockage of one valve getting in the way of the other, if you will. This is the exact same patient, but now they're treated, and you can see now that color is no longer quite as turbulent. It's much, much less color in there. That represents the fact that that blockage has largely gone away, and this patient is going to feel infinitely better. Here's another patient before and after. On the left, you can see what the patient's looking like before treatment, and you can see again that mitral valve bending over backwards, hitting the muscle, obstructing flow between the left ventricle and the aortic valve. And on the right-hand image, most of that has been mitigated, and this patient feels much, much better. How do we manage these patients? How do we monitor you on these medications? Well, as you can imagine, we have to monitor it by echocardiogram. So periodically, you'll come in for a limited echocardiogram, and we'll see exactly what's going on. And based on what we see on the echocardiogram, we can titrate the dose of your medication up and down to make sure that we have safety. We turn the power down just enough so that one valve doesn't get in the way of the other, and then we keep you at that dose, and you'll be feeling much, much better. And I want to reassure you that we watch you very, very closely. The medications are safe, we have enormous experience with them, and we will do everything we can to get you back in the game at Northwell Health.